In this video, we uncover 12 crucial secrets about urinary tract infections that could save you from pain, complications, or worse. Think a UTI is just a minor nuisance? Think again. From surprising causes to powerful home remedies and knowing exactly what to do, when, and what not to miss. So if you've ever had a UTI or want to make sure you never do, don't go anywhere.
What you're about to learn could save you a lot of pain, hassle, and even a trip to the hospital. Two kinds of UTI. One makes you sigh. The other, if missed, could make you die.
Did you know that there are two types of urine infections? Yes, you heard correctly, two. The first one is commonly called cystitis, which simply means a bladder infection. The other one is way more dangerous and even life-threatening. But before we delve into that, let's talk about cystitis.
Cystitis loves women more, something we can't ignore.
Here is a question for you. Why are bladder infections commoner in women? To answer this, you need to know that a tube called the urethra connects the bladder to the outside. Bugs enter through its opening, the urethral meatus. The female urethral opening is more exposed than the male's. In males, it's located at the penis tip, covered by the foreskin, which provides protection. But wait, there is more. The female urethra is only 3 to 4 centimeters long, while the male urethra is around 20 centimeters. This means bugs have a much shorter journey to the bladder in females, making cystitis more common.
Okay, let's talk about how to avoid these pesky UTIs.
Have you ever heard of honeymoon cystitis? It's a common term for UTIs that happen soon after sex. Sex is closely linked to UTIs, especially in women. That's why it's important to wash the skin around the vagina with water before and after sex and pee as soon as possible afterward to help flush out bacteria. Have you ever thought about how hygiene impacts UTIs? Good hygiene is key to preventing infections. Always wipe from front to back, keep the genital area clean and dry, and change nappies or incontinence pads promptly if soiled. Now pay attention. This is the most important part of this video. And don't forget to comment, like and subscribe.
Knock, knock. Who's there? Cystitis. Cystitis who? Cystitis symptoms.
What are the common symptoms of cystitis? A burning sensation when you pee, going to the toilet often, needing to run to the toilet, pain in your lower tummy, and pain in your lower back. On top of this, you might feel a bit under the weather and have a slight temperature. Okay, now you're thinking, when should I see the doctor? I'd say not just yet.
So you're looking for a home remedy? Well, we've got a secret fix. And no, it's not a potion from your granny's cupboard. Keep watching, friend.
There are a few measures that you can take at home. Take paracetamol and ibuprofen for the pain and drink plenty of water. Are there any effective home remedies? Yes, but only one truly works. Here's the science behind it. Cranberry juice? No good. It doesn't kill the infection, and the sugar in it may even help bacteria grow. Potassium citrate? Nope. There's no solid proof that making urine more alkaline helps, and the prize for the only effective home remedy goes to D-mannose. Bacteria bind to D-mannose instead of the bladder lining. When you pee, bacteria bound to D-mannose is flushed out. This helps prevent or minimize infection. So can I have antibiotics now?
Antibiotics! At last. Took you long enough.
Okay. Before that, here is something you might not have known. Your local pharmacist can prescribe antibiotics for uncomplicated bladder infections. Yes, you can just walk into the pharmacy. No need for a GP appointment. Here's something surprising. Did you know there are two ways to prescribe antibiotics? The first is delayed prescribing, used for mild to moderate symptoms. You hold on to the antibiotics for up to 48 hours and only take them if symptoms worsen or persist. This helps reduce unnecessary antibiotic use and potential side effects. The second is immediate antibiotics, given when symptoms are severe enough to affect you. The most commonly prescribed antibiotics are Nitrofurantoin and Trimethoprim. Others may be used in cases of allergies or intolerance.
Finally, it's time to do what we all love. Join the sacred telephone queue for a doctor's appointment.
I'm number 4 in the queue. Living the dream, baby.
Hurrah!
Here is another dilemma. When should you see a doctor? You'll need an appointment if there are complicating factors, such as being pregnant, under 16, having a bladder catheter, or recurrent urinary tract infections.
And they keep coming. Let's delve into recurrent cystitis.
You might not realize this, but if you have more than 2 UTIs in 6 months, or more than 3 in a year, you have a condition called recurrent UTI. Did you know why recurrent UTIs are more common in women after menopause? The lack of estrogen causes urogenital atrophy, increasing infection risk in 2 ways. First, it leads to vaginal dryness, itching and burning, weakening the skin and vaginal lining. Second, weakened tissues can cause uterovaginal prolapse, where the uterus and vagina shift downward. If the bladder moves too, it forms a cystocele, creating a urine pouch where bacteria thrive. both major risk factors for cystitis. With recurrent UTIs, sending a urine sample for culture is crucial to confirm if it's a true infection or another issue. Specialist referral is essential to find the underlying cause. Some may need long-term low-dose antibiotics to prevent infections. Another option is methenamine hippurate, a urinary antiseptic that acidifies urine. Many postmenopausal women benefit from topical vaginal estrogen to treat urogenital atrophy and reduce UTI risk. Wait, there's more, much more. Always watch for blood in your urine. If you see any, tell the doctor.
Peeing blood? Nope, it's not a horror movie. It's your bladder calling for help.
Blood in urine is called hematuria. There are two types of hematuria. The first type is macroscopic or frank hematuria, where blood is clearly visible in your urine. The second is microscopic hematuria, where blood is invisible. So how do we detect it?
Ready to give away that precious urine sample? Now's the time. Aim true and don't miss the cup.
When you visit the doctor, you'll be asked to bring a urine sample. The doctor will use a dipstick to check for abnormalities, mainly blood. Other key clues include white cells and nitrates, which indicate a urine infection. Did you know your urine sample serves another purpose? It's sent to the lab for microscopy and culture testing. Microscopy examines cells like red and white blood cells, confirming dipstick findings. The sample is then incubated to identify the exact bacteria causing the infection. The bacteria are also tested for sensitivity to common antibiotics. This helps the doctor determine which antibiotics work best and whether to switch your treatment if needed. Back to hematuria. Here is your take-home message. Hematuria is a red flag. It could indicate a bladder tumor, kidney cancer, prostate cancer, or a kidney stone. Obviously, cancer is bad news, but catching it early makes a huge difference. That's why you should see the doctor immediately if you notice blood in your urine.
Kidney stone? Congrats! You've just experienced childbirth without the baby!
Kidney stones are especially concerning if there's pain. The pain is excruciating, comes in waves, is usually on one side, and radiates from your loin to the groin. They may also be linked to urine infections. Regardless of the cause, blood in your urine always requires specialist referral and further investigations. Wait, there are a few more factors that can complicate a UTI.
These are the symptoms you don't want to ghost, because if you do, they will haunt you.
Pain, confusion, and urethral or vaginal discharge. Severe pain in the abdomen, back, or groin means you should see a doctor to rule out other issues. Acute confusion or delirium is common in elderly patients with urinary tract infections. If someone over 75 develops sudden confusion, it's crucial to see a doctor. Symptoms can fluctuate and include memory loss, trouble concentrating, communication issues, behavior changes, and even hallucinations. Urethral discharge can be a sign of a sexually transmitted infection like chlamydia or gonorrhea. Vaginal discharge is common with thrush, bacterial vaginosis, or STIs. Now, let's reveal the life-threatening type of urine infection.
Hi, I am Dookie. Please like, comment, and subscribe for more mind-boggling content.
It's called a kidney infection or pyelonephritis. Let's explore this in our next video.